You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. And this is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And our topic today is autism awareness and the whole spectrum of autism disorders. So I have two expert guests with me today, Susie Maloney and Meagan Rohde. Thank you for being here.
Thank you for having us.
You were here a couple of years ago, I think, kind of talking about a similar topic or a similar look at it. But talk a little bit about what your roles are and how you came to know so much about all this.
Well, we both are early intervention specialists, and we work for the Board of Disabilities, Developmental Disabilities in Ottawa County. I started out in 1993, and Meagan's had about a 5-year run.
Yes. Okay.
We're licensed by the state, and we're required to upgrade our certification every 5 years, so we constantly go through trainings and conferences.
Okay. And so early intervention means early in life. Right?
Right.
You work with young kids.
We work with children birth to 3.
Okay, that's pretty early.
Yeah.
So talk a little bit about autism. It has certainly been more prevalent in the media and in the medical field. I think over time it has gotten more so. So talk about it and the spectrum of disorders, because I know there's a number of them.
Okay. Well, about 40 years ago, it was extremely rare. There probably were cases of it maybe hundreds of years ago. However, they probably looked more like family members that may have been diagnosed with other neurological disorders, schizophrenia or things like that.
Okay.
Probably were maybe misdiagnosed. So through the years and with technology, we've become a lot more astute to early development and what takes place. And now we have the benefit of genetic testing and brain scans to actually pull the whole diagnostic piece together.
Okay. So it was around probably forever, but certainly 40 years ago is when it kind of started to be recognized a little bit more.
Well, actually, 20 years ago when I was first hired in, we did not see the same kinds of kids that we're seeing today.
Okay.
The extreme behavioral issues, the restrictive eating, most of them had different diagnoses, and through the years we've just developed more and more cases. So the prevalence of the neurological and brain disorders seems to be increasing.
Gotcha. So talk a little bit about the spectrum. There's autism, but there are a number of other disorders that have similar features. Talk a little bit about the whole spectrum of disorders. Either one of them.
We've noticed an increase in ADHD, ADD, a lot of different sensory issues that kind of play into autism. So a child may have a dual diagnosis also. So they may have a diagnosis of autism along with one of these other diagnoses. A lot of them are neurologically based, and we're noticing an increase, as Susie had mentioned before, in the neurologically based disorders.
Go ahead.
But autism has 3 hallmarks of the disorder, and it can be in varying degrees. We do have children that can have a lot of language, but the quality of language may not be there. They may have echolalia. They may not be able to have social intent or conversational speech.
Okay.
And there is a regressive kind of autism where the child had language and lost it. So depending on where the child is and in the child's development, it can gain momentum and become regressive, or it can have an early onset, and with some early intervention, we can see some milder forms and some real improvement.
Okay. So the hallmarks are language issues, social interaction issues primarily?
Correct.
Okay.
And behavioral.
Okay.
Behavioral issues are huge. A lot of repetitive movements.
Okay.
A lot of them based sensory-wise, where they need a lot of sensory seeking and a lot of sensory input.
Okay.
Just repetitious movements for comforting, for self-comforting.
Gotcha. Okay. And you said it kind of presents itself sometimes right away. There's signs you can tell very, very young, even when they're an infant. And then other times children are developing like a typical child and then kind of regress back.
Correct.
Oftentimes with infants, we'll notice a lack of eye contact, a lack of that bonding. They don't do the social smiling. They would prefer to be alone, and they don't enjoy that bonding piece that a lot of infants do. Then there, like you had mentioned on the other side of it, there's some children who do that and who have the language and make great eye contact and socially engage, and then at some point they start to regress and they start to lose those skills.
Okay. So what should people be looking for? Not to incite panic and oh, my child didn't give eye contact today. Let's not panic. But what are some of the signs and symptoms or things that we should be looking for either in infants or in a little bit older?
Well, we know in infancy that newborn babies a day old will look to their father's voice, will localize and find mommy's sound because they've heard their parents' voice early on.
Gotcha.
A little bit older babies will check into their parents and look to see in the room where's my mom.
Okay.
You can get some reciprocity of eye contact just by holding the baby, and if a baby averts or a child averts your look when you try to maintain eye contact, that's a big sign.
Okay. Okay.
So what we're talking about basically are two major subgroups or subtypes of autism, but there are many subtypes of autism.
Okay.
So the early onset marks one, and then the later onset, we're actually finding out that little boys who have a regressive onset at 18 months or 24 months, they have accelerated brain growth, accelerated head growth, where the little girls who have regressive autism, they don't have the same symptoms. So a lot of the indicators now are looking strongly at genetics. The fact that the environment somehow interacts with genetics, and that field of research is called epigenetics, and it's growing a lot of momentum in the last 5 years. So we're actually finding that during our diagnosis process that the genetic piece is important as part of our multidisciplinary, because there are certain genes that are definitely lend itself to syndromes of autism, such as Rett syndrome. There's a thing called tuberous sclerosis, Angelman syndrome. There are different etiologies for autism, and that's why it makes this so complex. But they're also finding out that there are a number of genes that are high risk because we're finding gene mutations.
So it's complicated, and no one should be expected to remember every little syndrome and everything that we're going to talk about today. But there are some things that they can look for in terms of their infant or their young child's behavior. Is there genetic testing that people can do? Can they do it before a baby's born? Can they do it if the baby or the child is not having any symptoms, or is it something you only do if you're suspicious of something?
I think at this point in time, that would be determined by a multidisciplinary team after the baby's born. years down the road, we may find out because there is suspicion that the gene mutations are happening in utero.
Okay.
And we know that there are some moms who are at high risk for having children with autism.
Okay.
If they've had an autoimmune disease, they've been exposed to certain things in the environment. So usually the genetic testing will happen after we have done a screener, and then the family talks with the physician, then they may get another referral to a developmental pediatrician.
Okay.
And then there's a whole nother multidisciplinary process. So the diagnostic phase can last a year, over
Okay.
a year, and it's very involved.
So would you recommend somebody call their physician first, or can they contact you, or either one is just fine? What do you, if somebody has suspicions?
I think that we would be a good place to start,
Okay.
the Help Me Grow program. There, I think, are unfounded fears now about children having autism. If they have delayed language, well, a child could have delayed language for numerous reasons, ear infections or prematurity or a variety of things.
Okay.
So we really actually would be a good place to start
Okay.
because we do the initial developmental testing, it's standardized testing that the state requires. And above and beyond that, if we see worrisome signs, then we can do an informed clinical opinion where we will follow that child and make the recommendations for the medical specialties.
So you can kind of sit down with a family, do an assessment, kind of go through family history and all that kind of stuff, and
Correct.
kind of rule out, ear infection, and they were, like you said, language or different things could be from a whole host of things.
Correct.
Which might not be autism or any kind of disorder.
And our service coordinators are really great about looking at the family's insurance and helping them refer to developmental pediatricians and developmental specialists that their insurance will cover. So
Right.
we also have that piece too, where the family's not going to be out kind of searching for a needle in a haystack, trying to find someone that's a good fit or find someone that's close. The service coordinators work with the family very closely to help them set up those services also, so they can get further help.
There can be several factors why a child might present as having concerns to a parent. We have an OT who's excellent at looking at sensory defensiveness, sensory integration issues, and a lot of our preemies or babies who have had a rough start will have that, and it doesn't necessarily mean that they have the diagnosis of autism.
Okay.
But it
They were
could
just
present
premature
that
and-
way early,
Okay.
early on.
So you do want to keep an eye on those kinds of things, or?
Correct.
So what ages does this typically get recognized? And I guess it depends on if it's the regressive, because that would be later where a child is starting to walk or talk or babble back and forth and then not. So it's kind of any age. I mean, do they still start
Typically-
recognizing in grade school, or?
Typically, we get a lot of referrals because of late language, no language, or regressive language usually seems to be one of the big red flags to a mom or parent. A lot of times, children do not look when their name is called, and that's a big one, a big
Okay.
concern, because parents usually think, oh, there must be something wrong with my child's hearing because he's not responding. So I would say that a lot of times it's between 18 and 24 months, around that period where we usually get referrals on children.
Some of that you can't know until they start.
And that's when we really expect their language to start taking off, is that's that window when they start to add additional words and use language more appropriately. Instead of just doing the babbling, they're labeling items, labeling mom, dad, milk, cup, things like that. So we expect their language to be picking up, and that's when a lot of times the parents, kind of the red flag happens, because they're like, my child's not really doing this.
Yeah.
And then when we come out, there's typically other red flags that they just
You can catch
Yeah,
and
you
help
can
them
catch
figure out. Okay, so you would be a good resource for a first stop if you're having some questions or something. All right, well, that is good to know. We're going to take a break right here, and we will be right back talking about autism awareness. autism and the spectrum of disorders and autism awareness. And we're talking about signs and symptoms and ages and those kinds of things, and then kind of where people can turn to get some help to kind of weed through this whole process, because it can be a lengthy process to rule out all kinds of other things as well. And I know when someone gets a diagnosis of anything, diabetes or anything like that, they want to know what was the, why did this happen? What can we do to not have this happen again? And I'm sure this is probably like a large can of worms, so we'll keep the lid on it a little bit, but what are some schools of thought on causes? You talked about some genetic, some triggering. What are the schools of thought on the causes?
I think the biggest thing now is that there's an interplay of environmental things that we know are neurotoxins to the brain, chemicals that are very common, lead, mercury, a lot of flame retardants and things like that, that even our moms-to-be may be exposed to. So the schools of thought now are that there are some predispositions with genes and mutations, but that the big piece is environmental factors as far as
being a trigger.
As being a trigger. And it could also be, for example, they're now researching surfactant, which is actually a steroid that is given to babies in utero to develop their lungs, because the doctors may know that they need to deliver early. And so they're studying that and following along to see if there is a high incidence of ADHD. So there are medications, a plethora of things that are unknowns that we are doing now to save babies or for quality of life. A mom may need to take a seizure medicine or something during pregnancy, and then how again will that affect the baby? So some of the adverse effects we may not know, but it certainly seems to be just a combination of things and very complex.
And again, it's more important of, okay, now we have this diagnosis, now what are we going to do about it versus, I mean, if you can know a cause so as not to have it happen again for future children or whatever, that's good to know. But so what happens? How does this impact people? When you go out and you interview with families and you do assessments and things, what does it look like in a family? How does it impact them?
I think it depends on the family. There are a lot of families that they really struggle with the fact that there is something going on with their child. It's definitely a grieving process. It's something that they have to come to terms with and really figure out what it's going to mean for their child and for their family. We have a lot of families who just want to know every single thing that they can do to help, and they're just eager to get started and start all the interventions to get their child up to level and to really get going with our services.
I think the difficult factor is that it's such a mystery disease, and every child looks so different behaviorally, that a mom may have an inkling, or she may feel the gut instinct, there's something wrong here, or even the dad or the main caregiver, because they spend 24/7. But often family members are not they're incongruent with their feelings about the situation, and believe that because autism presents behaviorally, that it is something that is a behavioral issue and not necessarily a neurological, a medical issue. So a lot of our families have conflicting things that it does affect marriages very much so, because you can have one parent who is not in support of the other parent getting intervention. There's a stigma about it.
And because there's levels of severity. When somebody says autism, we think of maybe somebody we know with it, and that's what it looks like to us. But you've talked in settings I've seen before where there's a
low functioning and high functioning
variety of what it looks like, and so people might think it's one thing when their child might have it in a different form.
I'm recalling a mom whose child was referred to us. It was a set of twins, and he was the brother, where there were concerns and great regression. And she had already, because she was in the medical field, had done a lot of research, started the Play Project, which is an intervention for children with autism, had gone to a pretty well-known university and got the diagnosis for her son with autism, and started the ball rolling, and then came to us for more help. And she took him back after 3 years of intervention, or possibly 2 years of intervention, to the university, and there really was a conflict as to should they take the diagnosis away from him because they were not seeing the manifestations.
Gotcha.
And she did a holistic approach, tried the gluten-free diet, she did ABA, she did a lot of things, and was truly, we think, able to dodge the bullet because the brain has neuroplasticity between 0 and 3,
Gotcha.
More so than if you're working with a stroke victim later on and you're trying to rehabilitate them. We have much more.
They're little sponges at that
yes.
age,
You
which is
can
good.
rewire them, essentially.
We can create different not transmitters, but
Pathways.
Mm-hmm.
Okay. So can a person, once you have a diagnosis, can it be cured? Can the diagnosis go away, or you can at least address many of the behaviors and different things along the way so that it's not so severe?
I would
That's the hope,
say
anyway.
more than the diagnosis going away. You can address the behaviors
Okay.
and really work on a lot of those areas. And maybe a child who looked like they were going to be more severe may not end up being as severe
Okay.
by the time that all the early interventions are done, and their behaviors may have decreased and their language can increase through. I know Susie had mentioned Play Project and ABA. Both of those teach children social skills and teach them eye contact. So a child may not present as severe because they're able to engage socially.
Okay.
Because it's been taught to them.
Okay. And talk a little bit more about those interventions. You said there's therapists and there's all doctors and all kinds of things. Talk about the interventions that can help get a child a little more higher functioning.
Well, as Meagan said, we can rewire the brain. A lot of that is through what's called ABA, Applied Behavioral Analysis. It used to be very regimented, and now the specialists now can use it in such a variety of ways that it actually helps the child through all routines of the day.
Okay.
But we do know that there are 5 different areas of the brain that can be affected when you have autism. And so intuitive thinking, a person with autism understanding what another person is thinking at that given moment, social skills, some of those things, the nuances don't ever go away.
Okay.
The person is able to fit in society and is able to be somewhat recovered and doing well, but often may still have obsessive compulsive tendencies and things of that nature. So we don't think of it as a cure, our interventions. We think of it more of a recovery process.
And that's where you step in. You can connect them with all those different things
Yes.
to help. Talk a little bit about, we'll put a little plug in here for Project Lifesaver, because that is one of the interventions. It's for anybody who's at risk for wandering. So many times people think of elderly people who have some kind of dementia, but it also is an issue with children with autism. Talk a little bit about that.
Project Lifesaver, it's available in Ottawa County now. Susie and I, and
Yep.
you also are involved with the project. And it's an awesome thing for our community. It's a transmitter that an individual can wear, and it's just another line of defense, another line of safety. So if a child were to get lost or go out into the community and wander, we are able to call the sheriff's department, and they're able to help locate that child.
Okay.
And
that is one of the behaviors, one of the risk factors with autism is safety awareness kinds of things.
Children and adults with autism are very concrete thinkers, and they don't often have deductive reasoning and don't understand danger. If I go so far I may not be able to see my mom in an amusement park.
Right.
She may not be able to see me, and therefore I don't have the language to say what my name is, who my
Right.
parents are, that kind of thing. So a child may not necessarily be a wanderer per se, but be at risk for safety issues that are out of their control.
Okay.
The lack of impulse control and different factors like that can just put them at higher risk.
Okay.
They
So
may
that's
see.
I was just saying that's where Project Lifesaver comes in. It's just another safety, another backing.
And it's not a free pass for a parent to say, now I
No,
don't
not
have
at
to
all.
be so diligent. It's just an extra thing when there's crowds and certain situations that
Or
could
if
be a
there's,
little bit more.
Ever that emergency. Right.
Or if
It's
you
there.
have other children in the family and you're doing something together, the other child may
Only have
distract
two
you.
eyes. You can
Yeah.
only look.
Absolutely, absolutely. So,
That's a helpful, one of the helpful interventions that's out there for
Yes.
them. And do you said adults with autism, does a person, you can get to be higher functioning, we rewire brains when we're sponges, but these things can carry on into adulthood then? And do they look the same, or you said they?
well, I guess I would say that our population now of individuals that have neurodevelopmental disorders or autism, as well as Alzheimer's, dementia, whatever the reason. But that population, now that are adults, they didn't have so much the benefit of early intervention. And they very much are at risk still.
Okay.
They may have tunnel vision and have an obsession to water or something shiny, and they just have tunnel vision and just will go. And
Okay.
drowning for our individuals with autism is the highest statistic actually for morbidity to
But now, because of advances in early intervention, you're able to reach children younger and younger and help kind of maybe prevent that or address that earlier on, so maybe they can be a little bit higher functioning as they move into
Yes.
adulthood.
absolutely. Yeah.
And that's why you do what you do, I bet.
It's very fulfilling,
I
but
bet.
our families are awesome, and they are under immense stress,
Yeah.
and it's wonderful to have autism awareness. As we're approaching April,
April 2nd is National Autism Awareness
Very
Day.
cool. All right. Well, we'll keep that in mind. But it happens 365, so you guys are a good resource to reach out to, and we thank you for that.
Well, thank you.
All right. We are going to take another break, and we'll be right back. And we're back. I want to thank Susie and Meagan for being our guests today, talking about autism, which could be a topic for many, many hour television show. So we kind of just really touched on just some of the basics here. And it can be complicated. It can be a little bit scary. They're a great resource. Their phone number out there is 419-898-0400, and then dial extension 3141 to get some more information and to talk to somebody out there. So again, just take this information, and whether it's for you or somebody you know, be sure to share it and get the word out, because there's a lot of help available. If you ever have feedback about a program or a suggestion for a future episode, let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Carla Pelz at the high school, cpelz@pccsd.net. So again, think about everything we talked about today. Be sure to share that with others for awareness. And until we meet again, I encourage you to make time for health.